Fantastic. Thank you. I know this is like never ending. It's right one after another, no breaks. But thank you so much for, I know it's the afternoon of the second day, but really great. Thanks for sticking around. And thanks to our panelists as well. Again, my name is Bryant Lin, clinical professor of medicine, co-director of the Center for Asian Health Research and Education, and I'm also a stage 4 lung cancer patient myself, never smoked a day in my life. And I'm really proud to and happy to lead the patient panel today, to moderate the patient panel. We want to start off by thanking Dr. Louie and Dr. Volota for recruiting their patients to come speak today. I know it can be difficult to speak about your own case or your loved one's case. So really thanks to the doctors for helping us find patients, and thank you for volunteering. We're going to start off by just everyone telling their own story about what their diagnosis was and how they were diagnosed, and introduce themselves. And then we'll go into a discussion here, and I'll save a little bit of time at the end for the audience to ask questions as well. So we'll just go in order, please.
Hello, my name is Susan Brim. I'm an emergency medicine physician at Kaiser in San Francisco, and I was diagnosed with stage 1 lung cancer when I was 37, about 8 years ago now. I did actually have symptoms. I had some very vague chest pain that led to a workup. I was treated by Dr. Bellotta with a left upper lobe lobectomy, and then have been undergoing surveillance. I did, towards the end of my initial surveillance, develop a second lesion in the left side. And so after watching that for a while and having it grow, I did decide to do SBRT about 2 years ago. And so now I'm continuing to have surveillance and am doing well. I think Dr. Bellotta asked me to come speak on the panel, and I feel it's really important for me to share my story, both as a physician and a patient. And I am Asian. I'm half Chinese. My mom is Chinese, which, I never was aware of the statistics and the work that you guys are doing until my diagnosis. So I'm very excited for all of the research that's being done in this.
Thank you.
Thank you, Susan, for sharing your story. My name is Phuong Ho. I am also a Kaiser physician in emergency medicine at Fremont and San Leandro, so not too far from here. I was diagnosed with stage 1 lung cancer 5 years ago in 2020. It was actually in the midst of COVID. As you all know, as an emergency physician, we see a lot of patients coming in with severe illness due to COVID during the initial stage. And during that time, I actually had mild respiratory symptoms with chronic cough and chest tightness for about a year. And I was treating myself like I was having asthma symptoms. And so during the beginning of COVID, I treat a lot of patients with respiratory symptoms, and I have concern about myself that if I truly get really sick as a frontline worker, then I would need to know my underlying condition instead of just treating myself. So I seek out medical attention with my primary care doctor, evaluating for asthma with pulmonary function tests, but everything came back normal. I requested a referral to see a pulmonologist and had a CT scan of the chest. And so that's how I found out that I had a lesion on my right upper lobe. And thankfully, I was treated by Dr. Bellotta, just like Susan, and I had a right upper lobe lobectomy. And I've been cancer-free for the last 5 years, and I have been undergoing surveillance with CT scan every year. I am here to support all of your work and wonderful research that you've all been doing, and to help advocate for all the patients, especially Asian non-smoker, and to educate all of my friends, family, colleagues, just to kind of look out for any patients who never had any history of smoking with any chronic respiratory or chest symptoms, and to keep lung cancer under a differential diagnosis and to provide screening early. Thank you.
Thank you.
Hi, I'm Alice. I'm not a medical professional. I was trained as an engineer, but I'm here to tell you my experience of how the low-dose CT scan for lung cancer detection saved my life. So 26 years ago, my mother was diagnosed with lung cancer, and she never smoked. And during her treatment, her oncologist basically told me that now you have a family history, you should pay attention. So at that time, I didn't know what to do with that information because, obviously I was quite a bit younger and there wasn't sort of an available test that I could, take to do anything about it. But it kind of all stuck in the back of my head that maybe I was at a high risk. So over the years, I kind of read a little bit about, the headline news that there is an increased risk for Asian American women. So a few years ago, I actually went to my primary care doctor, and then I had asked her about this lung cancer screening test, as well as telling her about, my family history. And at the time, I think because of the guidelines, my primary care doctor told me that there is no benefit for me to do the screening and that there isn't any clear sort of genetic connections that puts me at a higher risk, despite the fact that my mom, had lung cancer. So I kind of put that to rest because, you tend to trust what your primary doctor tells you. But then the risk problem was still, in the back of my head, and I was trying to figure out what to do about it. Like maybe about 2 years ago, I actually went ahead and, did a Gallery liquid biopsy test, and that showed basically nothing. Last year, Stanford had an outreach program called Health Matters. And so I came to just, learn more about it. And I was just extremely fortunate to have walked past Dr. Natalie Lewis' booth. And she gave me information on the low-dose CT scan for lung cancer detection and gave me the information to follow up, to discuss more about, whether it's appropriate for me. And so I called and I spoke with someone very knowledgeable, and we went through, the specific risk factors for me. And so I decided that that was the right thing to do, and I didn't particularly think that I might already have lung cancer, but I was just thinking that since I have an increased risk, maybe sometime down the line there will be a problem. And so if I take it early, there is a baseline. But long story short, the imaging review revealed something not good. Subsequently, that led to a diagnosis of stage 1A2 adenocarcinoma. And 7 weeks after that diagnosis, Dr. Louis performed the robotic lobectomy and removed my upper right lobe. That was 5 months ago, and I recovered quite well, and here I am waiting for my first 6-month scan.
Thank you. Thank you.
Hi, my name is Maggie Shiffrar. In 2022, my younger sister had a abdominal scan that just happened to catch the bottom of her left lung, and it was found out she had a mass in the bottom of her left lung, and follow-up testing showed that she had stage 3 lung cancer, EGR positive. EGRF positive. Yeah, then the world falls apart, doesn't it? She had a lobectomy. She was on Tagrisso for 3 years. It's been 4 years now. She's doing absolutely great. I had been a professor of psychology and retired so I could take care of her, which is just so ridiculous now because she is 4 years disease-free and just living an absolutely beautiful life. But I think I'm here because it took me 2 years after her diagnosis to finally call and schedule a low-dose CT scan, even though my sister had participated in an organization called Go2 in San Ramon, which is a terrific support group for people with lung cancer, and I highly recommend it. And they were constantly, the mantra was, get a low-dose CT scan, get a low-dose CT scan. It still took me 2 years. I was scared. Our maternal grandfather had lung cancer. I couldn't understand how I had been exposed to a lot more smoke than my sister because I'm older and we grew up in a family of smokers. I lived and worked in New Jersey for 23 years, which should be just in and of itself. Sorry, no Jersey bashing, but not the healthiest place to live. So I had convinced myself that I was not going to get good news from the low-dose CT scan, but I finally did it. It's literally easier to do than ordering a cup of coffee at Starbucks. I mean, I couldn't believe how easy it was. And I, got the result that I have a lot of nodules that would be good to track, but I'm okay, which is such a gift. Low-dose CT scans are such a gift. Thanks.
Thank you.
Yeah, hello. My name's Rob Snyder, and I got to thank, first of all, Dr. Louie and her team for doing such a great job in tracking down my CT scans through the years, and her project manager, Laura Shula, was another great gift. She set me up with Dr. Louie and her team, and it all started early September of 2024. A spot on my lung, I knew it had been there for a few years, but this time it grew a little bit bigger. So a couple weeks later, they sent me up for a biopsy, and it was time to get it. So I met with Dr. Louie later that month in September, and from there, by December 4th, she had my midsection of my right lung out, and since then, I'm all good. But again, if it wasn't for her and her PA, Laura Shula, I'm sure that there's great doctors around, but I really give her a lot of credit and thank you.
Thank you.
I think that's it.
Yeah, great. Thanks. Next. Yeah, thank you.
Hi, my name is Xuenian Wang, and I'm also Dr. Louie's patient. I found out that I had a lung nodule in my lung in 2022, totally by accident. I was in China visiting my parents, and if you are familiar with, if you know the China medical service, you can get a very comprehensive workup at a very reasonable price. And the low-dose CT scan is the standard one. So I did that, and they called me a few days later. They said, hey, there's a nodule in your lung, and you should go see a doctor. At the time, I wasn't too worried because I'm not a smoker. I don't drink. I have no family history. I have no symptom. I work out. So I'm pretty healthy. So I wasn't too worried. Then I came back, and I saw the doctor. I said, hey, I did this. And then they told me to see a doctor. And they said, Then they order another CT scan, a CT here at Stanford. So I repeat the CT 5 months later, and they called me again. They say, hey, there's a nodule. My primary doctor said that you have 2 options. Either you repeat in 6 months, or you go see a thoracic surgeon. Then I chose to see a thoracic surgeon. And the first meeting, the surgeon told me he was very confident. He has 92% of confidence that this is a small cancer. I was blown away by the news because I didn't anticipate that. And I had no idea that the Asian woman is actually a high-risk group. Then I talked to a few other specialists. Everybody gave me the same opinion. So I decided, it's okay, I'm not going to repeat another CT scan in 6 months. Then I chose to go straight to surgery, and Dr. Louis was my surgeon. She did a great job, and the recovery went very well. After the first week, I was able to walk around in my neighborhood. After a month after the surgery, I started hiking. 6 weeks later, I went back to work. And now I'm almost 3 years after the surgery. So everything went well. And I also, one more thing, I started the Natera MRD with Dr. Neil. So far, so good. All the test results came back negative. So I'm here today just to support the work you're doing, and also I want to raise the awareness. I work in the tech industry, so a lot of my coworkers, they are Asian people. Not only, pretty much, like a lot of them, they are not aware that Asian people are the high risk factor for the lung cancer, and most of them, they never smoke. So, and as far as I know, a lot of early stage lung cancer people, they don't have symptoms. So when they discover, it's just too late. I don't know if, and then the CT scan is not a standard screening test here in the United States. So I think that's something, maybe, yeah.
Great, thank you. Thank you very much. I know it's not so easy to share your story that's very personal to you. First set of questions, and we'll get to the awareness in a minute. Anything that, in terms of generally with you or just in general with the diagnosis, the treatment, what worked well, what could be improved, just thinking about yourself, but also generalizing to other patients?
Sure, I can start. What I will say is that, so I was lucky that I did have a symptom that led to my early diagnosis, but the path to the diagnosis, and this is 2018, so there was even, I think, less awareness of this happening in, young Asian female never smokers. But I had this mild chest pain that, as an ER doctor, I would have completely blown off, but it was just really persistent. And it led to, a workup with my primary. My chest x-ray actually was negative. And I continued to just keep an eye on it, but it just wouldn't go away. And I ended up kind of just having a sense that something was wrong with this. And I reached out to a pulmonologist colleague and just asked them to see me. And that's how I ended up getting a CT scan. And I mean, my mass wasn't that subtle. It was a pretty big mass. And it was kind of abutting the pleura. It was spiculated on the CT. And even with that in front of us, at the beginning, the pulmonologist, the interventional pulmonologist, everyone said, don't worry, this is not lung cancer. Like, you're too young, you don't smoke, like it's going to be infection. You work in the ER, let's make sure it's not TB. Let's, it's take antibiotics. And I think that is the thing that I think increasing awareness even among clinicians to like, yes, this is lung cancer. Like you are actually, it's not that surprising. This is lung cancer. And so that's kind of the thing that, in the retrospectoscope, it's easy to, I didn't have any delay in diagnosis or anything, but it's just interesting to me that we anchored so much and kind of in that bias because of my profile. And then when I got to Dr. Villada, we were chatting on the phone. He said, by any chance, are you Asian? And I said, yes. And, he was the first one that was just not surprised. Like, of course it's lung cancer. And so I think that that's changing and that's evolving. But that would be my input for something that could change is just the awareness of clinicians to have this on their differential, that this is, that this happens to people like me too. So that's one big thing I would say.
Great. What worked well, what didn't?
I think that the process to go toward having a diagnosis can be lengthy and difficult for patient if they're not aware of the underlying risk factors. Being a physician, I think I have a knowledge of certain symptoms and then seek out the medical attention. And so I think that to get persistently asking for workup and continuing to find out what's wrong is, I think, the key factor. Not only getting a chest x-ray wouldn't show much, as you all know, what I had for 2 chest x-ray during the year, and the lesion was not showing up. And so asking my physician to do further testing with pulmonary function test, referral to pulmonologist, and then a CT scan to be able to find out the diagnosis. And throughout the process, it can be very lengthy unless you as a patient persist in asking for further testing. And so I think raising awareness is very important, just so that you can, for the patient, can advocate for themselves in asking for further testing. And I think what worked well is to be aware of the underlying risk. And I think what's not working well for the patient would be knowing the process and to seek out the medical attention early for the screening.
Okay, so what I think worked really well, at least in my case, is that public outreach definitely works, especially for people that are already worried about, their risk levels because of family histories or environment or whatever. And so many people probably just need that one extra reminder or someone with a lot of knowledge to share the information so that it pushes them over to get these low-dose CT scans. It is unfortunate that the guideline doesn't really include so many of us, so then one has to pay out of pocket. But if one is able to, then it's the cost is well worth understanding the risk and saving your life potentially. So after my diagnosis, I think a few things that worked really well for me. One is, again, I will agree with you, Laura from Dr. Louis' team actually was the one that spoke with me and she and I had this pretty lengthy phone call discussing specifically my risk factors, and then I had questions about radiation dosage, exposure, and things like this, and she was able to answer them all. And so that really helped me making the decision and feel comfortable with doing the CT scan. Another thing that worked really well was between the time that the scan results came back and the results explained to me, and the time that I was able to see Dr. Louis for a consultation, you know, I asked Gemini lots and lots of questions, and then I kind of, you know, thought, okay, you know, if the chance of this thing being malignant is like more than 50%, then I'm gonna go for it, right? And so during my consultation with Dr. Louis, I'm just very glad that she was so confident that she's like 99% of the chance this is, you know, not good. And so that made the decision making very easy for me to kind of go ahead with the surgery. And then of course, you know, with all the advances in robotic surgery, my recovery was really fast, and that went really well. And you know, the care from doctors and nurses in the hospital was excellent, and so those are all the things that worked super well for me. In terms of the things that I think could be better, I think it's a sort of a consequence of the guidelines kind of having gaps and not catching the high-risk groups, is that I kind of wish that more primary care doctors are more aware, or maybe they're aware but it's not top of mind for them, of the statistics, because it seems like there's so much research and studies that have already collected and analyzed all the data that shows, you know, the signal is very strong, but somehow it didn't propagate to all the primary care doctors. And so often when we think about, you know, getting tests and screening, the first set of recommendations that you get is from your primary doctor. And so if your primary doctor isn't aware of you being in a higher risk group, then you might not get the recommendation that's specifically for you. So I think, I don't know what the solution is, but if there is, you know, a way, understanding that changing a guideline seems to be extremely difficult, but if there is a way to even, you know, sort of help bring along the primary care physicians, even within your own hospital, to, you know, sort of highlight these additional issues in the minimum, then, you know, during the annual physicals, we can have a productive discussion about, you know, what are the right things to do based on like your specific risks, not just, you know, a generic person. So that's that.
Thank you.
There's a very famous phrase, the future's here now. It's just unequally distributed. I have a lot of family in rural parts of America, and I know that the health care that they get is nothing compared to the health care that we get in the Bay Area. And it's hard when you're a patient to know what you don't know. In my sister's case, when she had this random abdominal image that showed a potential mass in the bottom of her lung, she, at that time, she was not a patient at Stanford. She was at another large medical system that will go unnamed. They sent her the results of her scan via an email and never followed up with her. If she, and that happened twice, she was lucky. She had a friend who was a GP, and she took the email to her friend and said, hey, what should I do with this? If we hadn't had that connection to somebody with the expertise of a medical doctor, I hate to consider that. So, Yeah, it's hard to navigate a system that you don't really understand as a patient.
All right, well, in my case, I really didn't have any negative issues whatsoever. With CT scans, like Maggie said earlier, they're a piece of cake. Go in and out, and you don't even, once a year, twice a year, do what you got to do, because without them, you can be in deep trouble down the road if that didn't show up. In my case, a spot that was there I knew years ago, and it kind of sat in that spot till, like I said, they discovered one in 2024. It was the same one, got a little bit bigger. So the biopsy was, that was in and out type of thing. Again, no negative problems or issues all the way through. Well, you can't beat Stanford. They're number one in the world. That's U.S. News, World Report, whatever. Without saying, they're good. I chuckle, but it's not a joke. They're great. You couldn't ask for anything better than Stanford Care, and the staff's. The whole facility is immaculate. But as I said, I had no negative issues. My surgery went well. 5 hours, 5 scars. Scars don't even show up. And I was up moving about not too long after. I wanted to do a little bit more, but she put reins on me for a month or two. But I obeyed, which I usually don't. But anyhow, my advice is get your CT scans. Maybe not just for lungs. There's other parts of the body that can be affected too. I mean, I lost a brother about 5-6 years ago with pancreatic cancer, and he was 7 years younger than me, and I'm old at 76, but I don't feel like it. My mom, same case when I was 10, back in 1960, she passed away from pancreatic cancer. So back then they didn't have such things as what we have today. So go get your CT scans, and thanks again for Stanford. They're the best.
Thank you, Rob. Xuenian.
Okay, so for me, since I found out my nodule by accident, when I came back to see my primary to tell her, hey, I have this nodule, she told me, oh, it was maybe overdiagnosed. Don't worry, you are a non-smoker. You are healthy. You don't have any family history. You are young. So she tried to talk me down, but I insisted, hey, since they told me to see a doctor, so why don't you do something? Then she ordered. So I think for that part, because her training, the guidance and everything told her, yeah, this is not necessary, and I have no symptoms, so I don't even. So basically, I think if I didn't do the workup in China, when I found out the lung cancer, it will be a major, very late stage. So I feel like I'm very lucky. So that part I feel it didn't go very well. I think maybe the guidelines should just treat the primary doctor just to raise the awareness. But after the meeting with the thoracic surgeon, then they know very well. They were very confident. And on top of that, my employer, they offer a benefit, so we can have access to Second MD. It's a company that offers a second opinion free of charge. So I was able to talk to other specialists. Was very helpful.
Thank you, Lynn. Let's move on to awareness. Maybe since we have 2 physicians on the panel, we can start with how do we raise awareness among physicians, and then the non-physicians can talk about maybe suggestions about how to raise awareness among patients.
Well, I think that's part of why Phuong and I are sharing our stories, and we share it in our hospitals and with our colleagues too, is I think that really for people to see the impact that an early diagnosis can have, and really the lives that can be saved by turning these cases into early diagnosis rather than later stage diagnosis. You can have such an effect on people's lives that I hope that can be impactful. I think it's just also something that with all the amazing research that all the people at the summit are doing, I feel like the word is getting out among clinicians. I think people are more aware. I think in the Bay Area, because we have a larger Asian population, I think the awareness may be a bit more, and the outreach to the communities also, in other languages as well is important. I met a woman, also an emergency room doctor in Arizona, who was diagnosed with lung cancer as well. And we were talking, I grew up in Arizona, and there's a much smaller Asian community there, but she was talking about trying to help raise awareness there, which I think is with a smaller community, it's harder. But I don't know, but I think that I do feel that it's very key, and also just in medical education to change the paradigm of what are risk factors or who can get lung cancer is going to be important for our future clinicians, and to have it on their radar. Yeah.
I think as patients, we're all here to support and raise awareness for of the Asian non-smoker that has increased risk. And being a physician, after my diagnosis, I share my story with my friends, families, and colleagues. That is also a part of raising awareness. I participate in the lunch talk or discussion at my hospital. Susan did her talk, Dr. Valota did several talks, and I participate in that. And I think that is also a part of raising the awareness within your own facility and communities. Just like Alice said, how do we get the primary care physician to be aware? And that is, doing the lecture, being there, sharing stories, and to keep doing that is one of the ways to raise the awareness in the professional. I also attended, go-to talk, and also I did a report with another oncology research, and share my stories. And it's also on Facebook. There's a video of me sharing my stories, and I think to get the story out there, to spread to other people in the community, especially in the Bay Area, is my way of participating and raising awareness.
Do you think we need a change in guidelines? I mean, it seems like the ultimate is, to have the USPSTF change, get enough evidence, but that can take 10 years or more and huge studies and, millions of dollars. What are your thoughts on that? Are there intermediate steps?
I think that given all the research that's going on, we all need to advocate for a better guidelines, just like Alice mentioned, that for a patient who has higher risk should have the benefit of having an earlier screening, like the low-dose CT scan, and make that into a part of the guideline, instead of just having the guidelines only for the smoker, because that will be too late. So I think there's a very specific and special need for the high-risk group.
I mean,
Sorry, go ahead.
No, I think that it seems like the data is very compelling, and with that FANS SS, data showing, that the rates in that population almost being higher than the the recommended screening, smoking population. But I think the timeline for a public health task force screening recommendation, plus the infrastructure of that number of scans and the follow-up for the scans, which is something that I'm becoming more aware of with my second nodule and my young age diagnosis, and then my second lesion. What I'm starting to wonder about is I'm not so scared about mortality for me. I'm scared about morbidity as I have more and more lesions and have to make decisions about what to do with them. And when my kind of recommended screening time is over, I feel like I'm going to advocate or want more screening for myself, having developed a second lesion. So I think there's so many factors. Like, obviously, I want a screening recommendation. I think there's compelling evidence, and I think it needs to happen, but there's so much that's going to go along with it that I understand why it's going to be difficult. And so I think the middle ground I see right now that can actually make a difference is just really clinician and patient education, advocacy, and on an individual level, people reaching out until we can get the right things in line for the population level screening.
Thank you. And Alice, I guess we can't have enough health fairs to catch everybody. Do you have suggestions about other ways for patients to learn, to build awareness among patients?
Yeah, obviously I have close to zero influence on the guidelines, like infinitesimally small influence on that. But I think the area that we can make a difference is in our sort of local neighborhoods and in our cities. And there's many sort of avenues where we can, not only just, tell our own personal stories, because sometimes people are like, oh, you are different, but I'm fine. But it's, I think, to put the actual, percentages in front of people, and then also tell them that these are the dominant risk factors, so that people have that information that they can kind of judge for themselves, in addition to like success stories. And then, it's much easier to do within like, your neighborhood community or your city, because there's so many sort of local avenues that we can easily reach. And so that's something that I think we as individual, patients can do. And then the other added benefit of sort of providing all like the risk factors and the statistics clearly to the patients is that they can take all that information to their primary care doctor, and then they can, have a productive conversation. Because, I can't just tell a random person to go and get scanned. Nobody will believe me. But if information is presented to the primary care physician, then hopefully they have a more productive conversation.
And Maggie, your sister was diagnosed kind of incidentally on an abdominal CT. Has your perception changed about CTs? Because there's a lot of fear about radiation, and how do you think that will impact our ability to not only raise awareness, but to, get engagement? For smokers, the uptake for screening CTs is very low, even at a place like Stanford, right? One of the lowest rates of screening in terms of USPSTF guidelines. So did your thoughts of radiation exposure from CT scans change? Did it evolve? And how do you think, we should manage that with patients in discussing this?
Absolutely. And even listening to the sessions today and yesterday, I had no idea how low dose was at Stanford. People had said it, but orders of magnitude, it's incredible. It's incredible. When something's comparable to the amount of radiation I would get on a flight that I would think nothing of taking, we're in a whole...
Or maybe we should get on fewer flights.
Yeah. Yeah, imaging's never fun. I mean, for me, like the first thing that comes to my mind is, okay, mammograms. I know it's a completely different technology, but the association is imaging, ouch, right? This is not going to feel good. I didn't know if it involved some kind of marker. I mean, I should have known better. So, like, I really can't emphasize enough that it's literally easier, for me at least, than ordering a cup of coffee at Starbucks. It's so simple. But I say that...
And we get your name right.
Yeah. But I had the means to pay for it, which is, so, we got to get insurance companies have to start paying for these scans. And I appreciate that Stanford doesn't charge a whole lot, but in this economy, $500, $550 is a lot of money for most people. So that's an issue too. I also think, the stigma around lung cancer is such that we just sort of don't talk about it. I mean, for example, my sister was with GoTo last year in Washington, D.C., on the Hill, advocating for increased lung cancer research funding by the federal government at the very time when our we'll just say administration, eliminated all federal funding for lung cancer research. We should have taken to the streets. I mean, we need to start thinking as a people who have overcome this stigma and lead by example.
And Rob, it sounds like you're a big advocate for CT scanning. Has your perspective changed, though, before you kind of got the CTs? Like,
No.
Now you've learned?
Not really, because I spent most of my career in construction for 33 years as a sheet metal worker, and then the last 12 or so at Amtrak as a pipe fitter. So I was around a lot of, back in 60s and 70s, all kinds of asbestos and nasty chemicals. But the low-dose radiation in the CT scans, nothing compared to what I was around. But made it this far, and thanks again for Stanford medicine.
And how do you suggest we raise awareness among patients about lung cancer in non-smokers?
Well, they themselves have to, there's advertising out there, I'm aware of that, but if some people maybe not even go to their general practitioners, your primary carers, and I mean, like was said before, it would be important for them to press the issue, but people need to wake up and realize cancer is everywhere. It's just, lungs is #1 killer, I believe, but, it seems it's growing in everybody, and sooner or later it pops up. So the CT scans, it's a natural thing to do, but then again, there's a whole population out there that probably isn't educated as well as the Bay Area people are. So I kind of at a loss other than, people have to wake up, smell the coffee.
Great. Xuenian, you obviously went to get scanned in China, right, as part of a kind of a wellness.
Right.
Did what were your thoughts about CT scanning? Were you worried about radiation, or you were, fairly confident?
No, I wasn't. I wasn't worried about the radiation because I know it's a no dosage, so I wasn't worried about that. So for raising awareness, like I said, I had no idea that the Asian people are the high risk factor. Before I thought I'm pretty safe because I don't smoke, I'm pretty healthy, I'm young. I have no idea of the lung cancer. I think this has nothing to do with me. I have no knowledge. I don't work in the medical industry, so I have no idea. After I was diagnosed, then I start, doing my own research. I go to YouTube, I read books, go to YouTube, trying to, see if there's any information I can learn. And I found out there's not many, not a lot. I mean, there's a lot documentation, but it's more for the medical professional to read. Just for people like me, there's not many resource you can go to. I do find out on the YouTube one of the video from Dr. Louis, but not a lot. So I think, like, and also podcast. So whenever I see or I hear something, then I forward to my friend. But if there's, like a institution like a Stanford, if you can, like provide more like short videos, like about this, I think that would be very helpful.
Great. Sorry, go ahead, Meg.
Your ideas prompted, you're right next to one of the best psychology departments in the world. And they had a very famous guy, Al Bandura, who dramatically increased reading literacy in a number of countries by getting them to show adults learning how to read in soap operas. In those, so like, can you get storylines? And we're not that far from Hollywood. Storylines into Pitt or something so that people can see how easy it is.
Right. Oh, it's great. Anybody have Hollywood connections? Yeah. Oh, there you go. So we got 9 minutes left. I'll ask the question I asked the earlier group. From your perspective, if you had $10 million to give, maybe some of you do, we don't know. Would you give it to? We've got Dr. Guo sitting there. He's our radiologist. Would you give it to him to improve our low-dose CT screening and make it even lower radiation? Would you give it to Dr. Dean, to improve our next generation, which he's working on, blood tests, so that we can have good blood tests for screening? Would you spend $10 million on awareness? For patients, would you spend $10 million on awareness to get lung cancer and non-smokers on the guidelines? Where would you, or would you spend it on research for next generation therapeutics? What would you do with $10 million for lung cancer? Where would you suggest we would do with it? Like you said, we've got limited funds, so we've got to decide where to go, and I would hope the patients really have a big influence on where the funding goes.
Wow, I would want to give it to everyone, but
then everybody gets $1,000. Then it's not, so. You get to make one bet.
One bet. Okay.
One bet, yeah.
I think probably number one would be screening and figuring out what the right populations to be screened in a high yield way is, because I think, I have an MPH, like prevention. If we can prevention, early diagnosis, catching things early, keeping the down the line effects from happening is the best for everyone. To have an early diagnosis, a surgery, and be done. So I think that's where I would really, really focus. I think for my own selfish, my individual case now, the things that I'm really interested in is, I was diagnosed at 37. I hopefully have decades of potential time that I can also develop more and more lesions. And so understanding what surveillance in someone like me should be and what intervals it should be. And then as I get these new lesions that I'll probably get more of, like the work into understanding which one of those are going to be indolent, which are going to be aggressive, which ones do I need to ask someone to do something about, or, because there is, I do have, effects from my treatments. I don't have the exercise tolerance I had before. And, as time goes on, I have many, many years of potentially more treatments that will worsen that. So I find that really interesting to be able to kind of determine which of these are going to be the ones that need to be taken out. But I think if I only can pick one, it's screening and early diagnosis.
I agree with Susan. $10 million is probably not enough for all the things that we all wanted to do. But I think that I would put the money toward getting the guideline established. We seriously need the indication for the high-risk population written to the guidelines and to get the screening early. And also for surveillance, for after 5 years, if, for the patient who get yearly CT screening, and then what happened after 5 years, given such a high recurrent rates for lung cancer. We still need the continual support for the surveillance even after that. What are we doing after every year for the patient?
I think they go very hand in hand too, because once we get the surveillance going, we're going to have lots and lots of us to follow. And so needing to know where to go from that, it's just hand in hand. That's why we need both.
I would give $5 million to support trials and studies to show definitively, the statistics of this high-risk group, so that hopefully it will be enough to convince the regulatory bodies to update the guidelines. I have no idea whether that's like a small amount of money that wouldn't make any difference in those trials, but anyway. And then for the remaining 5, the other benefit for the trial for the $5 million is that, as I learned from the results of the talent study presented yesterday, that you can learn so much about the correlations between, disease incidence and environmental factors, and I think it's really important to understand what in our sort of environment, in our, like diet and lifestyle that would increase our risks, so that as patients, then we will have the knowledge of, by ourselves, doing something to lower our risks, of future, cancers or something. So that's one part. The remaining part, I think, I would like to invest in sort of newer technologies that will help making continued surveillance safer, which basically means like 2.5 million will go to the lower dosage, CT scans. I saw all these results with, photon counting and all the other sort of AI-enabled technologies that would lower the dosage, because we most likely will require lifetime surveillance, and so the cumulative dosage is likely going to be higher and higher, which will put us at risk for like some other diseases. And so I'd like to see more development happening there. And then the other one is the presentation that happened earlier about this MRD blood test. And so if there's more funding that could accelerate the progress on that front, I think that would be huge, because these are related, because then a blood test you can do so many more times than getting CT scans. So that's my vote of where the money will go.
I would find the most famous Asian American women in the world, social media influencers, athletes, actors, and I would videotape them getting low-dose CT scans, and I would videotape them with follow-up interviews so that they could post that information to all of their followers and spread the word that way.
Wow.
Nice job.
I don't think that'll cost $10 million. Hopefully they'll volunteer, yeah.
All right, that follows Alice's move there. I already had a plan to give $5 million to Lucille Packard Children's Hospital right here on campus, and another 5 to cancer research, because eventually these guys are going to cure something. I mean, it's getting, things are getting better than it used to be, but I'll put $5 million in their direction.
Great.
That should do it.
Great, thank you.
Okay. I'll give the 10 million to the lung cancer research. So then they'll have better data just to help the policy maker to, maybe change the guideline, also the civilians and everything. So.
Great. Fantastic. I know we're just at time. Can we allow room for one question from the audience? Is that good? Okay. Question from there we go. Not. I know it's. I don't want to keep people later and later. So heard that.
Hi, just a quick question for the panel, and then actually a quick comment. I'm Dr. Alice Lee. I'm the 3rd female Asian emergency physician in this conference that has had non-small cell, non-smoker lung cancer. So, young scientists, that's a study for you. There's literally three of us here, all emergency physicians, female Asians. Okay. I'm really moved by all of your stories personally, and because I've gone through that. And I want to know, how did you handle the stress, anxiety, and fear that always comes with the diagnosis of cancer? And if you don't want to share, that's fine, but I find that's very much part of the whole experience of having cancer, right? And I'm very curious about how you guys handled it.
Anyone.
I can take a stab. I guess in some ways I felt pretty lucky that my diagnosis was very fast, and I also, I trust my doctors with my life, and so I felt very confident about my decision of doing the surgery. But of course, there's always times where your head goes into a black hole. And I think it's really important that when people say that you need to have friends and family that support you, and it's so true, because after I was diagnosed, I felt that my family came closer, and so you can kind of feel that they care. I mean, not that they didn't care, but it's very evident that they do care. So that helps. But then there are other times, like there's just too much going on in the head. So what I found to be helpful was I started picking up meditation, which I had never done before, but that actually really helped me. So.
Any other advice, suggestions of how to handle the stress of getting a cancer diagnosis?
I'm a retired professor of psychology, so this is a little self-serving, but therapy, and there are therapists who specialize specifically in treating people with lung cancer, and they're fantastic.
No, I just thank my family and Dr. Louie and her team she was so confident it was going to be a piece of cake, and I believed her, and good support with my wife and son and family, and went so quick and didn't have time to get too stressed out. Here I am.
Great.
I think for me, thankfully being in early stage diagnosis, there was just a lot of gratitude that it was caught when it was caught, and so that really helped. I felt more grateful at the beginning than stress felt later, actually. But a lot of gratitude for an early diagnosis. Yeah.
Well, I'm going to echo the gratitude, even as somebody with a late diagnosis. I think gratitude is a key part, at least for me. Grateful for the care, grateful for family, for friends. Any more questions? One more question.
It's more of a comment than a question, but what hit me when you said that, or Alice, when you said that you have no impact on the guidelines, you said they'd be so small, but actually you do. All of you do. And for all of you who are on YouTube watching this, each of you sharing your story makes a huge impact to all of the clinicians and people who are advocating for this, so don't underestimate your story. I think what we're missing, and what Stanford Care is doing is amazing. And I wish I could be an honorary Stanford faculty member to be even more of an active member of this, to really collectively take all of this together so that we can go to the Hill together, advocate for the guidelines. That's power in numbers is such a huge thing. It is going to take a long time for true guidelines to be made, unfortunately, but we can make noise so that we can expedite that.
Well, thank you so much for what a wonderful panel, and thank you for participating. I know it can be very intimidating to come to a medical conference and to speak in front of a lot of scientists and doctors, so really appreciate your coming here today and sharing your story, which I know can be difficult. So please, thank you.